Hi, I'm Dr. Sutan from Department of Community Health, Medical Faculty, University Kebangsaan, Malaysia. I'm presenting a topic on meet the needs of women for health empowerment in Malaysia urban setting. For an introduction, knowledge is essential in guiding a woman to improve her health status, family, and surroundings. This presentation aims to share some findings on the importance of constructing a framework to suit urban setting women empowerment based on women's health needs. I'm using in-depth scientific literature analysis to answer my research question, which is how the woman need can improve and promote health literacy among the population. Evidence already showed that importance of health literacy that leads to poor healthcare use and poor healthcare outcomes. So the question here is how to raise health literacy. Malaysia is fast approaching an urbanization country. 4 out of 5 areas in Malaysia are already gazetted as urban areas. The population growth increases population and the gender ratio getting closer. Now it's 106 men to 100 women ratio. Looking at the population composition, Malaysia is aging, and the current more considerable proportion were among the working age group of 15 to 64 years old, leading to an increase in work demand. An increasing number of women join the labor force, especially those who live in urban settings. In pursuing a career, people start delaying their marriage, which leads to fewer family members as women get pregnant later in their early age, uh, causing reduces in birth rate. If we see evidence by National Health Mobility Survey, which conducted by National Institute of Health, Ministry of Health Malaysia, it showed an increasing trend of non-communicable diseases as a disease burden. The risk for the root of the NCD is related to lifestyle behavior that needs early identification, screening, and risk prevention behavior that needs to empower. However, the prevalence of health literacy among adults is still low for them to get awareness on the importance of early identification and act to prevent. As countries' healthcare services and socio-economic status is improving, the life expectancy is increasing, leading to more people ending up with disease burden. Empowerment is an essential link to health literacy. A dynamic and comprehensive approach to health literacy requires more interactive health education to guide personal and social change to be more profound participation. Therefore, it enhances control and beliefs in the ability to change own lives before they can continue empowering others in family and community. As enrollment in education increases, the cognitive function in understanding information and seeking information that is right for women is getting easier. However, access and readiness of health information for women must be appropriate to their needs, simpler to access, understand, and follow, and lastly, evidence-based effectiveness. With that trust, health-related behavior and outcome will be improved. The information created in empowering women must be designed in multi-layer approach to fulfill women needs and talents to social cultural context. Incorporating information from passive to interactive ways will lead to continuity of innovation diffusion through dynamic platforms. Women then will be able to make good decisions for themselves and their family. In empowering women in digital age three things we need to focus on. First, what are the basic functional health literacy? Second, how can we communicate in interactive ways? And the third is how to deliver health literacy from them to critically synthesize for their use and benefit. Therefore, in any learning process, the information must be targeted, which is personalized, well organized, and oriented to health outcome driven, required for educational experience and persuasion. Indicators on the effectiveness of any health intervention in promoting health empowerment must have a SMART indicator. If we measure how many leaflets, advertisement, dissemination, or the number of women attending the health camp, this is not enough. If we focus on how many women makes an appointment for screening also is insufficient. We need behavioral change to occur in them to improve health status as a health outcomes. To synthesize information and use it for their benefit is highly influenced by many layers that we need to recognize according to this model, as shown in the social determinants of health by WHO. Based on my experience doing research related to women empowerment, I try to share with you here how important for us to be sensitive enough to women needs when we want to design any health empowerment program. Research synthesis for sharing. Three evidence-based components related to women empowerment. First, we need to support from a non-professional peers to enable a woman to identify her needs. By looking on the healthcare personnel only is not enough. Information about the local community services and signposting. This is important because everyone believes in their peer support. Development of personalized if then plan to assess that support. So we need to provide a personalized care plan for them to follow through based on their customized plan. In related to healthcare services, it is important of existing law to be available, regulations or standard to ensure the standardized and safe provision of health services. Facilitating standardized online training and formalized standard operating procedures. Therefore, it encourages a same information being given out by the healthcare personnel to the woman for them not to confuse. Furthermore, we need to improve feasibility and acceptability in way of we need to have a regular monitoring in terms of the evaluation of the program empowerment. The third component is related to social, cultural, and perception. We need to internalize according to the motherhood myth. We know that women are so special. They have their motherhood myth that they are follow. So we need to internalize so that they will not feel is alien. And we need to respect with their self-sacrificing following the program of empowerment. And we need to provide social support for them to engage and manage. Yeah. And the last one is identifying trigger and communicating their needs for help using interpersonalized counseling. Women nowadays, especially those in urban, are highly accessible to digital health, and therefore any health empowerment program should be aligned for them to practice. Multiple use of information communication technology intervention in health promotion, peer coaching and planning, screening and opportunity, health challenges, and perception of barrier must be suited according to the woman needs. In conclusion, the main contribution of this presentation to the level of health empowerment policy is as follows. First, women empowerment based on needs can reduce prevalence of unmet needs of required service. Healthcare providers should be trained, equipped, and encouraged to take ownership of the implementation of the integration of services as holistic approach and woman-centered. 5 teams need to strengthen in healthcare delivery services, which is focused on empowerment related to knowledge gap, yeah, and service provision difficulties, benefit of social prescribing activities, physical barriers, and psychological barriers. Implement digital health for the purpose of transforming health system. Empowering digital is very important as a precision medicine. Market survey on women health empowerment shows an increasing trend. So it's helpful for the system-based digital IT person to create a new apps or new web-based system to empower women. Lastly, women empowerment through digital media is very important. Here I listed how to overcome the social, cultural, and technological barrier. First, we need to focus on role model. Second, training digital literacy and exposure. Third is formal ICT education. Fourth is mentoring by the peers. Fifth is transparent and inclusive based on evidence base. Six, networking and facilitating. Seven, access to the funding and financial support. Eight is flexible, targeted, lifelong learning, and it should be awareness. And last one, it should be digital innovation according to the dynamic change. With that, I thank you.